Thanks for listening to this month's Shay's Ask the Stewie Expert video series. We're excited to have Dr. Neil Koo from the Billings Clinic and Dr. Melinda Neuhauser from the CDC join us this month. And Dr. Neuhauser is our first ID pharmacist, so we're excited there as well. Please note that the answers here are those of the individuals being interviewed and not of their institutions. This month's question is how to ask for more resources for your antibiotic stewardship program and its expansion. Dr. Neuhauser, would you like to start?
Thank you, Christy, for inviting us to present on this important topic. I'm going to provide an overview of our updated 2019 core elements that I think really focus on how you can expand your stewardship program through working with hospital leadership commitment. We outlined 5 priority examples, what we call, within the updated core elements. And 2 of these are focused on giving the stewardship program leaders time to manage the program, as also to conduct daily stewardship activities, but then also providing resources, including staffing in order to really operate the program effectively. And we highlight that there are staffing suggestions in the Veterans Affairs Administration Directive that is publicly available online, and that is derived from a publication that is actually a staffing calculator. And then we also reference a survey that was published from a committee that was led by Shay, IDSA, and PIDS. And so that could be a resource to really understand how you could justify some of the FTE based on the bedside of your facility. And then the other priority examples that we list in the hospital leadership commitment is really ensuring that you have face-to-face time with the C-suite. And this was really derived from input we received from the stewards, that having that face time is really critical. You can have regular meetings, and you can then talk about what the robustness of your stewardship and how you could expand if you had more staffing resources. And the second priority example within having this face-to-face C-suite is having a senior executive leader to really be the point of contact or champion. And this, once again, can potentially help you identify resources within your institution. But now I really want to hear Neil to provide more practical examples from his institution.
Thank you, Melinda. So I'm here to kind of give some practical key points on how to request extra funding for any antibiotic stewardship projects or program that you would like to set in place at your organization. There's primarily 4 main points. The first is that it's really important to explain to your C-suite the need for this program. And the first step is to identify what that need is, and whether it's something as simple as trying to decrease a number of cases of C. difficile infections at your facility, to line infection and such, but something that the C-suite will be able to identify with. And then tie that to why is it important, and whether that is because it's a metric that's being followed by the Joint Commission, DMV, or any regulatory agencies that you're reporting to. And then finally is that you want to identify, or at least determine how much this issue is costing the organization. And usually that kind of will pique their interest in why that if it's costing the organization a substantial amount of money, that it would tend to pay a little bit more attention to. Once you have explained the need, then you want to explain what the cost will be. And this ranging from any new personnel that you may need to hire, as well as any new software that you need to be purchased to help you to accomplish the goal that this program is being set up for. And after determining the cost, the biggest thing that the most C-suite members want to hear is what is the return of investment? What they're going to get out of this. And some of this is pretty simple, that if it helps them to alleviate a lot of the costs that let's say a hospital-acquired infection would incur to an organization, that certainly can factor in. But also that if there is any revenue potentially that can be generated from the program, that's also should be included, so that will kind of well, certainly help support the cause of the, to convince them to fund your project. Finally, and if you're fortunate enough to get the program up and running and funded, you want to provide regular reports and updates on the project, and you want to ensure that the C-suites know that what they invested into your program is having a substantial impact, not just on the goals that you're trying to attain, whether it's decreasing rates of infection and such, but also some of the monetary benefits for the program.